So I'm going to step out of my normal content here, but make no mistake, this is still my wheelhouse. It is something I know quite a bit about and deeply care about, and it is veterans care. So you may have heard of Dr. Glaucom Fleckham. He does really great videos vilifying the current state of our healthcare system, and he cloaks the tragedy of the system in his humor. If you haven't followed him, please do. You may have also heard of Dr. Elizabeth Potter and her efforts to fight back against medical insurance companies. Again, if you haven't followed her or Dr. Glaucom Fleckham, please do so. They do outstanding content. But they focus mostly on private insurers. My focus is on VA healthcare. And I'm not as funny as Dr. Glaucom Fleckham or as well spoken as Dr. Elizabeth Potter, but this is something that is critical. There is this new push to help veterans by pushing them into the privatized market. And this drive to privatize veterans healthcare is not about improving outcomes for veterans, but about unlocking a massive new revenue stream for private insurers and hospital groups. The Veterans Health Administration is one of the last fully public healthcare systems in the United States. It owns its own hospitals, it employs its doctors, and delivers care directly to veterans, meaning insurers cannot skim premiums like scumbags off of wounded veterans and those that have served our country the way, unfortunately, they do to the rest of the population, including my family. Now, this denial of access to veterans costs insurers millions of potential customers, and it frustrates them. Groups like United Healthcare, HCA, and a myriad of other for-profit organizations that benefit off our illnesses would love this type of access. Every veteran enrolled in VA care is one less person paying into an insurance plan that they could be getting money from, one less person driving revenue for hospital groups, and one less stream of Medicare Advantage overpayments that these hospital groups love to receive. Now, privatization of veterans care cracks that system open with a flood of money to all of them, and they want that so badly. Now, the push began in earnest after the 2014 wait time scandal when Republicans framed the long wait times of over 28 days as problematic, and they were. And so they attempted to outsource care given to veterans, and they framed it under this notion of choice. In reality, it was a Trojan horse that gave corporations access to veterans care. The 2018 VA Mission Act was the turning point, expanding the Veterans Community Care Program and funneling billions in federal money to two outside networks. Two companies, Optum, which is a part of United Health Group, and TriWest, now control that outsourced care through regional contracts worth nearly $200 billion. The numbers tell the story. Community care spending was under $8 billion in 2014. By 2021, it was nearly $19 billion. In 2023, it approached $30 billion. By 2024, it consumed roughly 1/4 of the VA's entire medical budget. Each year, more dollars meant for veterans, hospitals, and staff dedicated to serving veterans are siphoned off and handed to private administrators who take their cut before routing veterans to hospitals that bill at a higher rate, costing taxpayers more money. Insurance companies benefit in two ways. First, through direct administration. Optum and TriWest earn billions as middlemen. Second, through Medicare Advantage. More than 1 million veterans are enrolled in Medicare Advantage plans. Those insurers are paid a federal capitation fee for each enrollee, yet the VA delivers most of the actual care. By law, the VA cannot bill the insurer for reimbursement. It means the government pays twice, once to the insurer just because they're on Medicare, and once to the VA for the actual care they receive. And the insurers pocket billions for care they did not provide. Various analyses estimated that more than $40 billion flowed to Medicare Advantage plans between 2018 and 2021 for veterans whose care was actually delivered by VA doctors. That is double dipping, and it should be considered fraud. In other words, insurance companies get paid for doing nothing while the VA shoulders the work and then gets vilified for wait times. Lawmakers have introduced bills to claw that money back, but the insurance lobby is very powerful and fights hard to preserve this windfall. Hospital groups also stand to gain. VA hospitals are specialized, they're lower cost, and they're tailored to the unique needs of veterans. When care is outsourced, it's routed into community hospitals that bill at commercial rates, again, to the taxpayer. Veterans with PTSD, toxic exposure from burn pits, such as I've experienced, or combat injuries, which are cases the VA is actually built and specialized in to treat, become profit centers for hospitals that would otherwise never see them. Every emergency visit or specialty consult purchased outside is one more invoice run through the insurance-driven system. As outsourcing grows, VA hospitals face staffing and funding shortfalls, which then become the pretext for even more outsourcing. It is a cycle designed to weaken the VA and strengthen private providers. The scale of the money involved explains the political energy behind privatization. The VA's total budget for 2025 is nearly $370 billion. Even a fraction redirected into private channels represents tens of billions for insurers and hospital groups. Lobbying records show companies like United Healthcare and trade groups like American Health Insurance Plans spend heavily in Washington to try to shape VA policy. The Koch brother-backed Concerned Veterans for America, which is a bullshit name, has run sustained campaigns to push this choice and this community care, all while downplaying that these policies systematically drain the VA and enrich corporations. Supporters of privatization insist it is about giving veterans more options, but the data cuts against them quite starkly. Studies show VA care is equal to or better than private care. I can personally attest to that at my VA here in Boise, Idaho, and that is on most measures. In many cases, veterans wait less time for primary or mental health appointments inside the VA than outside. But wait, Chad, didn't you just say that the reason for this was to get less wait times for our veterans? Yeah, originally the VA was struggling to keep its mandated wait times under 28 days, but the problem was more so in the realm of we had an influx of veterans coming out of the global war on terror. And instead of fixing the problem the right way by building more hospitals, hiring more people, and providing more care for veterans because of this glut from GWAT, they said, let's get our insurance buddies and our hospital group buddies paid. And they pay their big fat lobbyists and ensure their big fat politicians continue to get elected so they can continue this cycle. Now, one last thing is drug costs inside the VA are dramatically lower because the VA, by law, negotiates prices that Medicare plans do not. In terms of quality, access, cost, the VA model beats the insurance-driven model. The problem is the media and the lobbyists have said the VA is terrible for years, and this is driving this narrative that let's get them to privatize care. And what is on the other side of that privatized care is the same model that my wife and kids experience, that many people experience, insurance-driven premiums where they try to get as minimally care as possible. That doesn't fit what President Lincoln said when he said to care for him who shall have borne the battle and for his widow and his orphan. Not, let's get these insurance companies and hospital groups paid. The push to privatize veterans' health care is not a neutral policy debate. It is a deliberate effort to move money from a public system that actually does work, I know for a fact it does, into private hands that profit. The fact that there is a glut in the system is not because more veterans are coming, it is because they are trying to limit the costs of as many hospitals as possible so that their privatized counterparts can get that money. Veterans are the leverage point here, not the beneficiaries. They pull on America's heartstrings by saying veterans aren't getting the care that they deserve. Well, that's because you keep taking the veterans' hospitals away from them. Each dollar shifted out of VA hospitals and into community care contracts is another dollar denied to veterans' facilities and granted to these frankly evil corporations. Each Medicare Advantage enrollee is another line of revenue for insurers with no obligation to provide actual care. This is why there's this push for choice as the solution. Not because the VA is failing, but because the VA succeeds in doing what private insurers and healthcare groups cannot: deliver care without generating profit for them and to do it compassionately. Privatization is simply the strategy for tearing that all down.